and middle scalene, which attach to the first rib. In order to do that, we're going to have the patient place the back of their hand on the head this way. Then we're going to reach underneath the patient so that we can contact the first rib as close as we can to the transverse process of T1 and apply downward pressure on that rib. Similarly, we're going to stabilize the head here, and your instructions to the patient are going to be to lift your head up off the table and breathe in. And as he's doing that, we're pulling down on the rib. Okay, now breathe out. As he breathes out, we will match his resistance. Now breathe in and lift up again. And then breathe out and relax. And then breathe in and lift up. Out and relax. And we would do a final stretch. And then at that point, we would bring him back and we would reassess ribcage motion. To treat rib 2 exhalation dysfunction, we're going to use the posterior scalene. In order to engage the posterior scalene, we're going to have the patient turn their head roughly 90 degrees or as far as they can to the side. We're still going to have them place the back of the hand on the head. And we're still going to contact the second rib now, medially as close to the transverse process of T2. And apply downward traction on that. And the instructions are the same: to breathe in and lift up the head, and you're going to resist and apply traction. And then breathe out and relax. Breathe in and lift up. Breathe out and relax. Breathe in and lift up. Breathe out and relax. And then you would do your final stretch and reassess. For a rib 3 exhalation dysfunction, we're going to use pectoralis minor, and this would be true for ribs 3, rib 4, and rib 5 because pec minor attaches to those 3 ribs. So if any one of those 3 is your key rib, then you would use this technique. You're going to bring the patient's elbow out to the side, and then you're going to contact rib 3, rib 4, or rib 5, whichever is your key rib, just next to the transverse process, and pull downward on that. And then you're going to ask the patient to lift the elbow up towards the ceiling, engaging the pec minor. And just like before, you would have them lift up and breathe in, and then have them breathe out and relax, and then lift up and breathe in. And as they're breathing in, you're pulling down on the rib, and then you would have them breathe out and relax. And you would do 3 to 5 cycles of that, 3 to 5 seconds. And in the case of a key rib, that is rib 6, 7, 8, or 9, you can use the serratus anterior as your muscle to assist. In the case of serratus anterior, you're going to have the patient bring their elbow up and grab a hold of the back of their neck. You're going to contact whichever your key rib is, whether it's rib 6, 7, 8, or 9. And then your engagement is going to be to have the patient lift the elbow straight up towards the ceiling as you resist. And your instructions will be the same: to breathe in and push up with the elbow, and you're going to traction down on the key rib in question. And then breathe out and relax. And again, you would repeat that for 3 to 5 cycles, 3 to 5 seconds per cycle.